Kicking people off their health care doesn't help them get into the workforce. We know what works is affordable childcare, mental health supports, and more transportation. Those are the things that really help people get to work. Those are the barriers that are standing in the way. But the reality is most folks on Medicaid are working or have some kind of situation where it's just not possible for them to be in the workforce. The true population that's taking advantage of government programs like Medicaid is corporations that don't pay their workers enough to afford health care. This bill is going to be devastating for the state of Iowa. We don't even have a sense of how much it's going to cost taxpayers. We know in other states it's cost tens of millions of dollars, all to kick people off of their health insurance. And when we requested information from the department, they refused to answer repeatedly. They won't tell us how much it's going to cost. The thing that's really clear about this piece of legislation is that there's trigger language that cuts 181,000 Iowans off of the Medicaid expansion if at any point the federal government says we can't have these work requirements. Anytime you implement more restrictions, more hoops to jump through, more obstacles for people to get health care, it means a lot of additional government bureaucracy. That's costly. And in states like Arkansas or Georgia, millions and millions of dollars spent on this additional bureaucracy, most of it going to out-of-state consultants who come in to administer programs like this. And so we didn't see anybody from Iowa supporting this, but we did see out-of-state think tanks who are probably representing some of those out-of-state consultants who are looking to cash in.